I know BC is working on starting a pilot this week in long-term care with the rapid tests. I'm wondering how quickly you think you will be able to make a decision on whether this would be more widely adopted.
Yeah, so we've always said that we are looking for where the rapid test can play a role. It certainly will not be daily testing. That's not feasible or practical with the tests that we have. And as we know, they are not licensed for use for asymptomatic testing. So what we need to do is understand, one, if it's feasible, because one of the challenges we have in care homes is human resources and the stretched human resources, but also how does it fit into the screening that we do of people, of healthcare workers every time they come to work, and where does it play a role in helping us in that setting. We have, as I've reported on before, been using the rapid tests in other settings where we know it can be of benefit, particularly remote communities and in some of our shelters and our advanced surveillance in, for example, the downtown east side in Vancouver. And there's been challenges with the tests themselves. They don't actually work that well in the environment in the cold. So we're learning about where they might fit in. And yes, there's a number of long-term care homes in the Lower Mainland where we'll be starting to look at feasibility and whether they're of value in that setting.
Do you have a follow-up, Justine?
Yes, thank you. You said earlier today there was almost, I think, 1,700 active cases in long-term care homes. And I'm not sure, maybe you can clarify how many long-term care homes have new outbreaks. You said 6 facilities, but I'm not sure if those were all long-term care. But my question is, what does that say about what's wrong with the current screening protocols? Because clearly they're not enough.
Yeah, this is the question. We can't intuit where this virus is. And the screening, we are stepping up, of course, as everybody is. But we also have close to 60,000 people who work in long-term care. And everybody goes to work every day with the intent of doing their best to take care of people. And nobody intends to bring the virus in with them. It is so challenging this time of year when the virus is spreading so rapidly, and we're seeing that around the world and around the country. So yes, screening is a huge part of it, making sure that people are able to stay away if they're not feeling well, making sure we're able to test people rapidly, and we have a good response to that now. But despite our best efforts, yes, the virus does get in, and that's where we need to make sure that we're trying to detect it as quickly as possible, and it's becoming more and more challenging. And this time of year, we've seen this not just in care homes, but in other communal living settings, in farms, in workplaces, in the measures that we've put in place for gyms and settings where we could do things even a few weeks ago or months ago. The virus is transmitting very easily, and sometimes we don't recognize it. So we are looking at everything that we can do to try and protect care homes, and this is where vaccine is going to be so helpful, because we're able to protect those people who are working in care homes to start with, and residents themselves. And that is the focus of the first few months and weeks of the vaccine program.